Buenas tardes, así es, ¿en qué le puedo ayudar?
As a medical interpreter, Carla Sager gets phone calls like this one many times throughout the day.
Ellos serían los que le atienden
Before working as an interpreter at Tucson Medical Center, she worked as an over-the-phone interpreter.
Over the phone, you're just a voice, but in person, you actually get to talk to people, see people, help more, be more involved with the person.
This right comes from Title VI of the Civil Rights Act of 1964, which states that no programs that receive federal funding can discriminate based on national origin. If a person were to go to a hospital today and were of limited English proficiency, they would have the right to a medical interpreter.
You know, working in a hospital, it's critical that patients have that right and that they have access to a competent interpreter because so many things can go wrong.
They work as a language bridge, and just like any other healthcare profession, their main priority is the patient's well-being.
Events can happen that can really affect people's lives in a substantial way. It can change the direction of your life. Medicine is one. People get sick, and that can radically alter their lives.
The University of Minnesota put together an example of what can happen if there isn't an interpreter.
Like, why is he here today? It's like maybe he has a little gas or something.
Yeah, it's some little gas.
Maybe a little gas.
Having a family member or friend translate can endanger their health.
There's so many things that can go wrong because we don't know that the family member really is competent to provide the interpretation, first of all.
TMC is finding ways to make sure there are also healthcare professionals who can communicate with patients of limited English proficiency.
The first tier is just assessing that somebody is truly competent, fluent, right? That they do understand that Spanish, for example, that they are fluent in Spanish. So that's what we call a competent bilingual nurse or a competent bilingual employee. And that person then could communicate everything that they would have in English. They could provide that service directly in Spanish to the patient. So that's the first level, but they can't interpret yet.
As of now, TMC has 5 interpreters on staff, with a little over 100 certified bilingual employees. Frisbee Garcia hopes to continue to certify more bilingual employees in order to serve the 70,000 plus foreign-born residents of Tucson.
We have really made a lot of effort over the years to provide education to our employees so that they're aware of that, the urgency, the need to make sure that the services are provided.
In the meantime, employees like Seeger enjoy working as an interpreter.
Yeah, your voice is tired, but you feel like you really got to help people. You feel like a part of someone's day, that you did something good for someone because you got to help someone understand what's going on with their health.
She will continue to make sure people who have limited English skills will receive the proper health care. For Arizona Cat's Eye, I'm Maritza Dominguez.
For discharge, excellent. We'll send somebody over.
Thank you so much.
Thank you.